If an aspiring leader were to ask you about the two most important things they should do to grow their business, would it be safe to say something like, number one, develop an outcome-based mindset, and two, align the organization around those outcomes? Can we narrow it down to something like that?
Well, now you wouldn't be trying to put words in my mouth, would you?
No, of course not.
I actually think that's quite reasonable. I would add something though, which is trust building, which is common to them both. I think trust in healthcare, actually trust in any business, but I think we can all probably agree that trust in healthcare, given what's at stake for our families, our children, our grandparents, our best friends, being able to trust what happens in healthcare is really important. So since an outcome-based mindset, as you put it, and alignment of the organization around those outcomes, both, I think, build trust between colleagues, but also with the outside world that you're trying to interact with. I mean, by necessity, you have to listen very, very hard, not to what customers believe or think or prognosticate, but what they do. Because they're expert in what they do, they're not so much experts any more than we are in what the future holds. When you sit down with anybody and say, tell me about your day, tell me about this, this procedure, tell me about this disease, what do you have to do to deal with it? You start listening to customers in a very different way. You're not asking them for their opinion, you're asking them for their true expertise. And I think that builds trust there. And I think internally as well, when scientists and commercially minded people get in a room together and start asking fundamental questions about what happens in a business process at a customer, or what happens when a product is deployed by a customer, rather than what everybody thinks about it, I think that's very trust building. For me, the two things you mentioned, the outcome-based mindset and the alignment, bring about four things in turn. Competence, a sense of knowing what's going on accurately and with data. A certain consistency, because especially if you adopt this approach, as we did systematically in the organization, you can develop the outputs that are the charts, the data, the analyses that allow everyone to see opportunities in a disciplined way. I mean, is there really an innovation opportunity here, or is it just, are we just guessing? So consistency. I think transparency is dramatically improved. We built, as you know, we built experience studios at our company where we literally built something that would look like the set of a movie, an operating room, a cath lab, an emergency room, where we literally walked through the use of the products before we built them to actually see what would it be like using this in the real world. What are those innovation opportunities that we're identifying? Are they real? A lot of emergency room medicine, as you know, is very time-based, for example. So, if something's going to take half an hour, you can forget it. So a high level of transparency. And then, of course, when you talk this way about real things that are happening with real products in real situations rather than guesses, and looking at the opportunities in an orderly, almost mathematical way, you automatically also create mutuality between the different stakeholders, whether they're internal stakeholders, as I said, between the scientists and the commercial guys or the regulatory guys, but also, of course, drag your customers into your simulation suite and ask them to find out whether this theory of an improvement in an innovation is true or not.
That's excellent. And so it really is a shift in mindset. And I was wondering also, how did that contribute, or did it contribute to that 41% premium that the medicines company received when it was acquired by Novartis? Did they see that you had a different approach to innovation?
I believe so. It's always difficult to know exactly what's in the mind of a purchaser or an acquirer. But I think that by the time we we were sold to Novartis, we were working on a product for high cholesterol, which is, of course, a huge driver of risk in heart disease. And there, Tony, we had worried for years about the problem of adherence or persistence. As you know, a lot of people might be prescribed drugs to lower their bad cholesterol, such as statins, and they may take them for a while, but by the end of 1 year, 50 to 60% of patients or people taking these kinds of drugs have stopped taking them for no good reason other than the humanity of it. And we asked the question, not could we create a more powerful a more powerful cholesterol lowering drug? It's certainly rather like the blood thinning story. It had to be powerful enough. But the real question was, would people and could we help them be more adherent to their therapy? We came up with the idea that by using a very new technology called small interfering RNA, which was Nobel Prize winning science from 2006, that's when the Nobel was awarded, could we take that technology and deliver a drug once or twice a year by the doctor at your routine visit, and you wouldn't have to take any more tablets for the rest of the year? Because we have great drugs for lowering cholesterol, statins particularly, but we're human and we don't take them for very long. And we wanted to innovate on that axis rather than greater potency. And again, I think that came from our outcomes thinking. That came from a mindset of what's the real problem here? What can we really solve? What the job to be done? And we, in our product development plans, we used to have, a paragraph at the beginning on job to be done. In this case, I can't quote it verbatim, but it was basically, we want people to lower their cholesterol for their entire life. The idea that, for example, say we want to lower cholesterol by 60% is really useless, because if 60% for a week or a month or even a year in a lifetime is completely inadequate in terms of protecting patients. It was we had to find a way of getting people a lifetime commitment. And in medicine, there's a term, and in some other disciplines too, called disutility. Disutility, of course, means inconvenience and cost. And so anything in your health that is awkward to do or inconvenient or costs you money, you're less likely to do. So we were attacking the innovation problem, not from some fantastic new technology, although we were using fabulous new technology, but it was the problem to solve was lower disutility. Have people being able to do this for their lifetime, not for 6 months. And that really was, I think that did capture the imagination of the senior leadership at Novartis, who were very creative people. It also allowed us to have started negotiating and even landing some deals, because the product we were working on, the main product, was quite advanced. We, for example, undertook and signed a contract with the British government for the entire population of the UK, in which we were able to offer the opportunity for higher adherence in a population in return for them committing to a certain minimum amount of goods. And then in return, we would commit to a very attractive price. And then in return for that, they committed to incentivizing physicians by paying them every time they use this drug. By the way, if I did that, it would be considered inappropriate. But in a managed healthcare system, that's considered, appropriately incentivizing physicians to do the right thing. So lots of win-wins came out of the mindset, and that deal is considered something of a landmark in the UK, and is now, I think, being used as a model for multiple new deals with cancer diagnostics, cancer drugs that others are now doing in the UK, and also beginning to talk about quite seriously with US payers, which is, of course, a whole different situation because the US is such a fragmented market.